Good afternoon, folks. Happy to take your questions.
Today it's reported that we've reached another high with hospitalizations in North Carolina. Can you kind of talk about the rising case numbers in Pitt County?
We are, as of today, as of this morning, we were at 492 cases, which sounds like a lot. That's in a county of about 185,000, maybe a little bit more. And of those 492 cases that we have recorded, 305 of those were considered recovered by last Friday. I haven't run the recovery count yet for today, but we anticipate that'll go up by probably another 20 or 25 people as well. So yes, cases are up. If you look at a rolling average, our rolling average is up a little bit. I think there's a number of things that contribute to that. First of all, when this started, we had a very narrow testing definition. As time has gone by, that testing definition has been gradually widened, and we are now testing a very wide swath of our community. So increased testing accounts for some of that. There truly probably is some more disease around. We're also a couple of weeks after the Memorial Day holiday, and people had a chance to travel and mix and mingle, and just like we see with influenza after the Christmas holiday season and New Year's holiday season, a couple of weeks after that we see increased influenza activity. So I can't say that I'm terribly surprised to see that is up. But and then there's the reopening too. We have reopened, so people are out and moving about more than they were before.
What can you tell us about the two most recent Pitt County deaths?
What I can tell you is they were both over the age of 65 and both had significant comorbidities. In the interest of the privacy of the individuals and the families, we don't want to release anything else. Our numbers are small enough that it would be pretty easy to figure out who those individuals are if we said much more. But they were over the age of 65 and had significant comorbidities.
We have received a couple of emails actually asking about 3 possible cases at Child's Place next to the Ronald McDonald House. Do you know anything about that?
We did have some cases there. It was in one wing of the facility. We advised them to send those children and staff home and to have them all tested. And our child care staff are following up with that.
And then also, what is your opinion on the possibility of a mask mandate?
I think masks help. The mandated issue, I'll leave to the politicians to decide if they want to mandate. From what the community should know, masks, certainly if you're wearing a mask, and since I'm more than 6 feet from you, I'm not wearing my mask at the moment. Masks do decrease your ability to transmit the infection if you have it, and they may offer some limited protection to you if you're exposed to somebody at less than 6 feet who has it. So I encourage the wearing of masks where you cannot be more than 6 feet from other individuals.
As we see the daily case count increase, does this show that people are practicing social distancing and that they are wearing masks?
I think some people are being less careful than they were before. It's important to remember to try to stay that spacing. I mean, if it's the same people that you live in the house with and you have lived in the house with for the last 3 months, you probably don't need to be 6 feet away from the people that you live with unless they get sick. But people that you're unrelated to and don't normally spend time with, yes, you should be trying to maintain that social distancing and wearing a mask if at all possible.
And you're wearing a mask right now. Have you been wearing a mask when you're going in public?
I do. I've also told my wife to do it, and she's been unhappy with me when I've said, honey, you need to wear the mask. I said, if I'm telling people to wear it in public, you need to do the same, and I've taken some lumps for that.
Okay, and the governor announced that money will be given to local health departments. So what's the Pitt County Health Department going to do with the money that they will be giving to you guys?
There's a couple of different funding streams. I saw that announcement today too. So what we look for is called an agreement addenda that tells us how we can spend that money. So we haven't actually received that yet. We are receiving some money through the CARES Act, and a generous portion of that, thanks to the county commissioners, will be going towards testing. And there'll be more coming in the days ahead about that testing program and how that's going to be rolled out to the community. But we will be increasing the amount of testing that we do in the community in the near future.
And today, DHH asked for
I think Vidant is in the same, again, first let me say I don't speak for Vidant Health. I believe Vidant's in about that same capacity standpoint of about a 70% capacity across their system. But again, I don't speak for Vidant. You're welcome.
Hi, Kayla Menges with the East Carolinian. Can you speak on proactive efforts Pitt County is using to combat the increase of cases?
We have internally reassigned 7 of our staff now, I think, Amy? 7 of our staff to contact investigation and contact tracing. So we have one of our disease investigation, she's actually a disease intervention specialist, DIS, yeah. And we've assigned her to kind of help lead that group. And she is used to doing that. She normally does that with another group of diseases that we are responsible for. And she has been calling people and advising people to stay home. We've assigned some of our other nurses to work in that area. We're also pulling some of our interpreters into that so that they can help with our Spanish-speaking population here in Pitt County.
Okay. Can you speak on the efforts that you're using to screen people? Have there been new testing locations? Is there a faster turnaround time for results?
Screening coming into the health department, do you mean, or screening? We've been doing that for several months now, so we screen for temperatures and symptoms and known exposure, known COVID positive status for clients coming into the health department. In terms of testing, testing is broadly available through the community. Vidant has testing through the emergency department, and they have several different platforms with turnaround time from a few hours to their slow test is now 24 hours turnaround time. ECU Physicians is also using the Vidant platform for their testing. So if you're tested through ECU Physicians, that goes into that Vidant testing stream. Physicians East, if you've been a client of Physicians East at some point, you can be seen at their urgent care and tested through their urgent care. Vidant Medical Group has one of their family practices, has drive-up testing. And a couple of our urgent cares have drive-up testing, and many smaller medical practices offer the testing to their patients privately. We have facilitated that in some cases by giving them the test collection kits and allowing them which lab to choose which lab they use to send that to.
Okay. In your personal opinion, do you think we can expect any announcements coming from Pitt County that might insinuate tighter social regulations?
I think again, I don't want to speak for our leaders. There's been some discussion about whether we should have a community masking ordinance and whose authority that could come under. In discussions with the county attorney, she does not believe that I have the authority to issue that as health director. Potentially the Board of Health could consider an ordinance requiring the masking of individuals in public. The other option would be for the commissioners to act under their emergency declaration to require it as part of their emergency declaration. But I don't speak for the commissioners.
Okay. And then lastly, today Granville announced that its Independence celebration will be canceled. Do you foresee COVID-19 causing alterations to holidays and celebrations in the months to come?
I do. I think it's unfortunate, but probably the biggest risk for spread is in bringing large groups of people together. So the 4th of July celebration, conferences, things like that. I read today that a very large fire rescue conference, a national fire rescue conference, has been canceled in Arizona because of COVID-19 concerns. The annual fire department instructors conference in Indianapolis was canceled because of COVID-19. There's a medical conference that I have gone to in the past, which would like to go to this year, will likely be canceled. I haven't heard officially on that. So I think these things are going to be canceled for in-person events, and at least in the short term be transitioned for, in some instances, to some sort of virtual event.
Okay, thank you for your time.
You're welcome.
I heard Dr. Silvernail that in the past 24 or so hours have been 51 additional positives in Pitt County. Is that something that
I have not heard that. Like I said, Craig, as of this morning.
I got a phone call later because that's why I asked. I couldn't verify it myself.
Yeah, as of this morning, we were at 492. Now, our numbers don't always match the state numbers. As I've explained in the past, there's some give and take that sometimes because people receive care in Pitt County, those cases are initially assigned to Pitt County Health Department or to Pitt County as cases. And when we review them, we find out that that individual might live in Martin County or Edgecombe County, and then we transfer that case back to the county of residence because public health surveillance is based upon county of residence.
And at this point, are you still comfortable with the amount of hospital capacity that we have, just hospitalization right here?
Again, I don't speak for Vidant, but I do see some of their numbers, and while they have patients, those patients are spread across the system, and it does not at this time appear that they're overloaded to me, but again, I don't speak for them.
When you look at the data, can you say that there's been a gradual increase in cases? Has there been spikes at time when there's been reopenings?
Our big spike in Pitt County was the nursing home, the East Carolina rehab, where over 2 days we had about 50 positives come out of there. And so that does, when you look at averages and rolling averages, if you don't take that out as an outlier, it does bump those up considerably. But even if you take that out, our rolling average would be up some. But again, we've also, if you look at this, we started with a very narrow testing definition and have gradually expanded that. So we're pretty much at the point now where almost anybody can be tested for the virus, even if they're not clearly exposed. So we are testing a lot more, and when you test more, you find more. We've had a number of cases that were asymptomatic, and estimates range widely on that. The CDC says that perhaps 35% of cases are asymptomatic. In a large case series that we're aware of in Eastern North Carolina, in asymptomatic testing, it's running about 0.8 to 1% positivity in that testing. We have a Walmart test site here. That data is hard to look at because it's not all Pitt County data, even though the store is here in Pitt County. But when you look at their numbers, they're usually about 3.7% positivity rate at the Walmart testing site. Our county positivity, again, we're struggling with getting all the negatives, getting all the numbers for the denominator. The state is struggling with getting all the numbers for the denominator. So if I use the raw data, right now we're up to 14.5% positivity rate. If I correct that for the negatives we think we should have gotten and make a relatively conservative correction of 100 negatives per day, that number comes down to 7.5% as a positivity rate, which has been pretty flat. We had, at one point back towards the end of March, beginning of April, we actually were 18, 19. One day we touched 21%. And then beginning on, I think it was April 15th, we started a downward trend and then have kind of leveled off at about 7 or 7.5% positivity. Our case fatality rate is 0.81% in the county right now, which is far lower than we could have ever hoped for. And let's hope that that continues.
Speaking in your own personal opinion, do you believe that there is any falsitivity of the national case numbers?
I don't know that there's intentional falsification of numbers anywhere. I would say that some of this is the fog of war, the fog of response. The problem with a novel infection is that there's not always a clear definition of a case. When epidemiologists get together, they nationally there's something called the Council of State and Territorial Epidemiologists that works with CDC to help develop what we call case definitions, and then we do our surveillance based on those case definitions. So with a brand new infection like this, that definition was put together very haphazardly with testing. We have only counted, and the state has only counted cases that had a positive test. There have been some places where they've assumed cases and used a presumed case number or probable case number as part of their cases. So that may serve to inflate numbers in some places. But in North Carolina, we were directed by the state epidemiologist to only report positive cases with a positive test.
How do you think the residents of Pitt County were able to keep our death toll low from the coronavirus? Because other counties have had a lower case count of coronavirus, but have had a higher death rate. So how will we be able to keep a lower death toll?
I think some of that goes back to that on average we have a younger population. I think the median age in Pitt County is in the 30s. So I think that helps from a death rate perspective. Being further taking longer for the epidemic to reach us or the infection to reach us did give a chance for our vulnerable populations in nursing homes and other congregate living settings to be protected. And that's helped because most of the deaths, a very high percentage of the deaths, have been in congregate living facilities like nursing homes.
And this outbreak at East Carolina Rehab, I mean, this is happening like a few months into this. Do you know how that started?
Well, they have sort of been on lockdown like all the facilities in terms of not letting visitors in. So we're pretty sure that at some point a staff member brought that in. Now, it could have come in with a patient transfer, but more than likely it came in with a staff member who had an infection and didn't realize that they had the infection. Okay.
How important is it that as things open up, that people still need to understand that they still have to practice safety as far as washing hands, hand sanitizer, and wearing masks?
Very, very important. Like I say, the infection is going to be with us for a good time to come, for a right good while. So we need to maintain our spacing. If you can't maintain your spacing, you should be wearing a mask. And obviously, when you're out and about, you need to wash your hands frequently or sanitize your hands frequently. And I think most of us are doing that. I need to commend the people of Pitt County. I think in general, they've done a good job of spacing, of hand sanitization, the masking. If I go to the store, it's hit or miss. Sometimes you go in and a lot of people have masks on, and some other stores there's less percentage of mask wearing. But I do see a fair number of people wearing masks. We could probably do a little bit better with wearing masks in public. But overall, I think our residents have done very, very well with following our directions and staying home when they were told to stay home and doing appropriate sanitizing.
When looking at previous coronavirus strain illnesses in history such as SARS, the Middle Eastern respiratory syndrome, do you believe that we're going the right way about this? SARS from the early 2000s, and MERS were probably less well adapted to the human host and burned themselves out. They also seem to, in warmer weather, burn themselves out in the warmer weather. So I think the first case, SARS, there were somewhat on the order of 10 or 15,000 patients with SARS in that first epidemic. MERS, I think there were maybe 8,000 patients. It was less than 10,000 patients. So they burned themselves out. Unfortunately, this virus seems very, very well adapted to us and is as transmissible as influenza or the common cold. So it's a difficult transmission to interrupt, but we've been able to do that to some extent. So I think for the most part, we've done what we can do with this infection. Given that we do not have a medicine that can prevent or effectively treat it, and we don't have a vaccine for it yet. Do you have any comment on Biden Medical Center and the Eli Lilly Pharmaceuticals doing a drug trial currently?
I know Dr. Cook. I know he's working with this monoclonal antibody that he was on the radio talking about this morning. It's a double-blinded study aimed at trying to improve the pulmonary symptoms of COVID-19 infection. So I'm glad that we're participating. And double-blinded means just that. Neither the treater or the treated knows what they're getting or giving. So I'm glad to see that we're participating in that, and hopefully this will be a drug that does prove useful in fighting the infection. Good? All right, thanks, folks.